Welcome to Life by Design, episode 372. Welcome to Life by Design. I'm your host, Dr. Jamie Richards, and I'm joined today by my colleague, Dr. Horatio Judd.
Always happy to be here.
Yes, we are creators of Life by Design with many locations worldwide. Each week on the show, we discuss the principles and the practice of Life by Design. Today, we're talking about posture, structure, more so structure here at Horatio, and high blood pressure. So I think this is going to be a great topic to get into. For those people who've listened in, they probably understand the difference, or at least have heard us talk about the difference between traditional chiropractic approaches and more of a corrective chiropractic approach. In the Life by Design model, we definitely fall within the more corrective nature. And I think when you start looking at things that are outside of the chiropractic realm and outside of chiropractic research and just looking at orthopedic research and spinal research, there's a lot of exciting things, because what it tells us, and this is really, I think, the point of today. So I'll give you guys the point right away. It tells us that there's a relationship between all parts of the body functioning together. So not just in an independent sense, but if something's wrong in one part, it's likely affecting something in other parts, whether it be measurable or immeasurable. And so today we're talking about a study that was done in the Asian Spine Journal. Essentially, it looked at structural changes. It took what's called a sagittal vertical axis measurement, which is essentially, if you look at the top of your, not necessarily spine, but at the base of your neck, measuring that and the forward position. The more forward we were, or the test subjects were, the greater the relationship between high blood pressure. So, Horatio, talk a bit about what the study highlighted and why we think this is important.
So, I mean, yeah, you found out the causal relationship is there's a link between forward posture and high blood pressure. Now, obviously, the question is why, and I mean, there's not enough data to have a definite answer on this, but the hypothesis put forth is that because high blood pressure, it's already known that it is, it's kind of a gateway to chronic cardiovascular disease like arteriosclerosis, stroke, heart attack. So now the authors and the scientists that conducted the study are hypothesizing that because there's microcirculation in the structures of the body. So It's really important to understand that, like, your discs and your spine, there's blood vessels that go through there, and the blood is pumped in through there. I mean, it's a slower mechanism, but it still comes from the heart, and it depends on the latency of the blood vessels. So now they're hypothesizing that the high blood pressure could potentially cause problems with the circulation to the discs and to the spine, and that could lead to earlier degeneration, which is like, the sagittal posture that you were talking about, the more forward you are, there's links between forward posture and disability and the predictability of becoming disabled and chronically injured over time. So they're saying that, because of the high blood pressure, people are leaning more forward. It might have something to do with the microregulation. But more importantly, we're seeing that there's a link between these two things, which is what we want to talk about.
Well, I think an important concept, which we've talked about numerous times, is just the difference between posture and structure. Because I know that people talk a lot about posture, and there's lots of healthcare providers that talk about posture outside of chiropractic, and that's great. I think posture is an important concept to discuss. The way I typically explain it to my patients is that if you have a postural problem and I say stand up tall, you generally can stand up tall, right? You can self-correct posture to some degree. If you have a structural problem and I say stand up tall or position your spine in a different position, and they're not able to, simply because there's degenerative changes, there's immobility, there's changes to the discs, there's changes to the ligaments, there's shortening of muscles. To me, that's more significant than a postural problem. And that's a structural problem. Although they've used the word posture in this study, I'd like to say that this is more likely a structural problem.
Yeah, I can't disagree. I mean, I think, and again, I would love to know, but maybe they are using the term posture because that's actually what they're measuring. I mean, it's more difficult to measure structure, Whereas it's pretty, it's not that challenging to put somebody up to some plumb lines, which is exactly what they did, and say, okay, well, you're leaning forward. Actually, that's not true. They took
they did full spine X-ray. So that's where I'm looking at it. Yeah, we're looking at radiology here. So
yeah, you're right.
And again, for people listening in, I think it highlights a higher level of assessment, right? To understand and look deeper. Not that people shouldn't do some self-assessment and recognize if they have postural deformities or abnormalities that could be affecting their health. But, when you have a structural problem, it I think elicits the emotion for people that there's something bigger going on. And that seems to, based on what I've read in this study, it seems to connect to this idea that the tissue microcirculation has been affected because of blood pressure changes, that would change, as you said, the blood flow into the disc and the ligaments. And of course, the way I envision this is the less functional those tissues are, the weaker those tissues are, and the more the spine is going to collapse. And then the idea of the spine collapsing, and obviously I don't mean collapsing where you just, you're a ghost and you fall down to the ground, but I'm saying as the spinal structures collapse, I think it's easy to visualize how that could affect cardiovascular function. And there is studies that look at structural changes in the sagittal plane and how those do affect longevity, how they affect cardiovascular function, lung function, pulmonary function. One of the tests we actually do in our biostructural examination is we measure lung volume. And not because I'm overly curious about how their lungs per se are working, but I'm curious as to whether structural problems can have an effect on their lung volume. And when we do make corrections to the spine and we see improvements in structure, are we seeing improvements in lung volume? And I'll say, now this is obviously an in-house study that we have all the cases and files on, but I would say it's extremely common, if not pretty much assumed to this point, if someone has a structural problem, especially affecting the cervical or thoracic spine, and they go through a corrective care phase, 90% plus of the time they have a significant improvement in lung function, although they made no other changes during that time frame. So there was no, they didn't go and start doing exercise. They didn't make any other changes. It was simply just that their structure was not compressing on the lungs and internal organ systems.
Yeah, but hold on. There's an RCT on this. It's the Dick-Holt study from 96, right? So
for the blood pressure, yes.
100%, right? So this is why this is really cool, because there was a correlation found the other way. So for people listening that don't know the study, Marshall Dick-Holt was an upper cervical chiropractor. So one of the chiropractors that worries about solely correcting C1 and C2. They ran a randomized controlled trial with a bunch of medical doctors, and the people who got the chiropractic care had lower blood pressure, so much so that the researchers conducting the study said that it was as dramatic as taking 2 blood pressure medications.
Correct. Yeah. So yes.
Now is chiropractic a treatment for blood pressure? No. Chiropractic is the improvement of spinal mobility and the release of nerve tension. And as a result, in those people, the body can function better.
Well, interestingly, I believe it was this study, if you actually tease out some of the data, in some of the cases, those who had low blood pressure also had an elevation of their blood pressure. So, you could almost look at it more of a balancing or normalization versus, this idea of treating high blood pressure, which makes more sense in I would say our model, right? That the body is self-healing, it's self-repairing. There's a drive towards homeostasis and adaptation. And in these cases where we reduce some type of stress load and the body then is able to function more normally, it makes sense that it would work towards a homeostatic change. And so it's not just, hey, I've got high blood pressure, you did this thing and now I have low blood pressure or lower. There's a problem affecting the entire body, the microcirculation, the organs, the ligaments, the disc, the nervous system. And if we can somehow improve that problem and make it less stressful on the body, I find it fascinating that some of the results were not just a lowering effect, but a quote unquote normalization effect. And then you start to say, well, what would that be in all these other tissues? And I think to me, when I look at a radiograph and we look at structure, and I'll say to a patient, what I'm seeing here is essentially an adaptation by your body over time to many, many different factors. But if certain areas of the structure are deteriorating or there's a degenerative change, it wouldn't be uncommon that also is correlated to the rate at which other tissues are deteriorating. We just can't see them, right? We're just not looking at them. That would be an interesting study, relating the level of structural deterioration to organic deterioration or dysfunction?
Sure. And I mean, to tie it home in terms of principles, we've gotten to the point now where, when it comes to medicine, I mean, medicine really is, the practice of seeing the individual systems, the individual organs and diseases and pathologies. And I think it's valuable. That's really important that we have that. But when you talk about health is, seeing the whole forest and understanding how, the water in the middle is going to impact the trees, how that's going to impact all the animals. Like it's combining all these different things. And it's understanding that there is in fact a relationship between, how your organs work and how your health is, right? So you can't just have, my health is good, I just have this thyroid problem. Your thyroid affects everything in your body. Right. So just because you might not be able to see it or test it, I mean, of course, we can't pretend that there is a problem because, we can't see it or test it, but like there's the potential for that to exist for you.
Yeah. No, I think that encapsulates the concept here today. And hopefully for those people listening in, as much as we're super pumped about this idea of the spine and structural change and how it affects microcirculation and just reinforces a lot of what we see, it's more important to recognize that you don't live in an isolated state. And this is just one instance as to how changing one structure, one tissue has an effect on all the other ones. And the take home is to start looking at your body and your health as a more global system versus as simply the symptom that you have or don't have as the criteria for whether you're doing well or not.
Yep, totally agree.
Awesome. Well, Cratio, maybe we'll see you later today by the sounds of it.
Sounds awesome. I can't wait to have a chat and for our kids to play with each other.
Awesome. Sounds good. Guys, thank you for joining the drive to 1 million families worldwide living life by design.